Hi everyone. I just wanted to go over a few items from last week. Sorry for the delay in getting your summary up. I am dealing with a bit of the flu or something, so I apologize for the delay. And you won't get to see my smiling face today. You don't want to see that. So, just wanted to go over a few of the items from last week. So, first, we'll go over briefly some of the things from the week itself. We had a great discussion on rewards in healthcare, so intrinsic versus extrinsic rewards. And I think that, and this isn't limited to healthcare, so it could be in any job. You can receive intrinsic rewards, or you can receive extrinsic rewards. And I think one of the things that came out and folks shared great examples from their work or um, or other examples that they'd had of where they had received those types of extrinsic or intrinsic rewards where just feeling good about something that they'd done or having been involved in a situation where management had involved them in decision making. Those are all those types of intrinsic rewards that can really make you feel good about being part of an organization or feel good about helping out patients, helping out customers, and those are all some of the reasons why we do what we do. And education is a great example of an organization or a type of work that provides a lot of intrinsic reward. A lot of the work that we do in education is certainly not for the money because it's not a super high paying job, but we do what we do because we want to help students. We want to help you guys. So that's why we do what we do. Because it's rewarding. We enjoy working with students, and we enjoy to help you guys, and hopefully help you guys to get in a position where you can help others. So that's we live those intrinsic rewards every day. So hopefully we uh, can help you to be able to, when you get out into the work world, be able to pass on some of those intrinsic rewards as managers to your staff as well. Um, the Gawande articles. So Atul Gawande, you read a few of his articles, and especially if you are a healthcare, I think we have all healthcare folks in this class. Sometimes we have people that take this as an elective, but if you are a healthcare person, or if you just have interest in healthcare, Atul Gawande is a brilliant healthcare mind. And he has a couple of books out there if you're interested just in reading some of his stuff. I'm pretty sure at the end of this class we actually watch a video, a TED Talk that he does. But some of these articles that we read this week, hopefully you enjoyed what you read. And he just has some really interesting insights into different aspects of the healthcare system. He's a physician. He teaches at Harvard in their School of Public Health, and just some really interesting insights into how we can fix our healthcare system. And I look forward to reading your papers, but I also would encourage you to seek out some of his additional work if you found his work interesting. So in our chapters this week, we took a look at both the evolution of the healthcare system and kind of how things have changed over time, the development of Medicare, Medicaid, development of different insurers, those types of things, but also beliefs, values, and the healthcare system. So a couple of pretty important areas that we reviewed this week. So be sure that that you have a good handle on those areas. And to that end, I'll talk a little bit about a few of the quiz questions that were missed. Um, and because I don't have a lot of voice, I did put them into the PowerPoint this week. So the first quiz question, how has Medicaid created a two-tier system of medical care delivery in the U.S.? So the question or the answer that was correct was many physicians do not serve Medicaid patients. So that was the correct answer. Now, the one that most people chose that was incorrect was funding for the program is shared by both federal and state governments. Now, that is true, that is the case. Funding is shared by federal and state governments, but that doesn't make it a two-tier system of care delivery. There care doesn't come from the federal and state governments. What's problematic about care delivery within the Medicaid system is that many physicians refuse to treat Medicaid patients. And it's not because Medicaid patients are somehow less desirable. Most physicians don't care what patients they treat, they just want to treat patients. What's problematic about Medicaid patients is that the reimbursement is so low that it doesn't cover the cost of treating the patient. So if you look at the average cost of treating a patient, you not only need to cover the cost of the physician's time, which if you talk to most physicians, they'd be willing to donate their time. Not for every patient, but at least for a few patients. But you need to cover the cost of your staff, who you have to pay salary to. You need to cover the cost of the lights and the heat, the supplies, the all of that overhead expense, rent in the building. You need to cover those costs, and with a Medicaid patient, you typically are not. And that's even if if the physician was to be donating their time. So this is why many physicians just finally have said no, we're not going to treat Medicaid patients anymore, and it's had this portrayal that somehow Medicaid patients are less desirable, and it has nothing to do with the patients themselves and everything to do with the Medicaid insurance product. So it's too bad. They need to fix the reimbursement in the Medicaid system so that these patients can get the treatment that they need to get well or stay well. And hopefully that, as these systems continue to evolve under the Affordable Care Act or wherever we're going with that in the future, we would be able to fix that. Second question, the inception of blank was used as a trial balloon for the idea of government-sponsored universal health insurance. And the correct answer there was workers' compensation. So workers' comp was created kind of as this trial balloon for a government-sponsored health insurance. Originally, workers' comp was really more of just like it worked more like payments, not necessarily coverage for healthcare, but just, oh, well, you're hurt, so it worked more like a short-term disability type thing. You got payments while you were out from a workplace injury. But then it transitioned to be more like a government-sponsored universal health insurance type thing. But with the advent of the greater use of private health insurance and more group health plans, whatnot, there really wasn't this need for this government-sponsored universal health insurance. So although it was kind of a trial balloon for that, there really wasn't the need for that going forward. The last question here is crude rates. So crude rates refer to the total population, and when we're talking about crude rates, we're talking about mortality rates. So it talks about that in our text, and when they're talking about crude rates, they're talking about mortality rates or death rates for the total population. Now you can have specific rates too, so you could have like an age-specific rate or a cause-specific rate, and those are obviously our specific rates that would be more detailed as opposed to the crude rate, which is just the entire population. So those are our quiz questions for the week. And I think that's all I had. So hopefully that is helpful. If you have any questions on any of the other quiz questions or on any of the material thus far, please don't hesitate to ask. And I look forward to seeing everyone in the discussion board this week. Thanks so much.